Socioeconomic status plays a powerful and often overlooked role in shaping both obesity rates and cancer outcomes. In low-income communities, structural disadvantages create daily environments that make healthy living not just difficult, but in many cases nearly impossible. These barriers accumulate over time, increasing the risk of obesity and, with it, a heightened vulnerability to cancers linked to excess weight, particularly those affecting the breast, colon, liver, pancreas, and endometrium. While individual choices are frequently emphasized in public health messaging, the real determinants of health in these settings are economic and systemic. One of the most pervasive challenges is the presence of food deserts, neighborhoods where fresh, nutritious food is scarce or unaffordable. Grocery stores with produce and whole grains are often replaced by convenience stores and fast food chains that sell ultra-processed, high-calorie, low-nutrient options. For families living paycheck to paycheck, the cheaper and more accessible options are usually those most likely to contribute to obesity and chronic disease. In these settings, eating healthy is not just a matter of knowledge or willpower. It is a question of access and survival. Opportunities for physical activity are equally limited. Parks may be unsafe, sidewalks may be broken or non-existent, and gym memberships may be out of reach. Schools in underfunded districts often lack robust physical education programs, and extracurricular sports can carry fees that many families cannot afford. The result is a daily reality in which movement is restricted by the environment itself. Without safe, accessible ways to be active, obesity becomes harder to avoid, and cancer risk increases over time through the cumulative effects of hormonal imbalance, insulin resistance, and inflammation. Healthcare access poses another major barrier. Preventive care, screenings for cancer, counseling on weight management, referrals to dietitians or specialists is far less available in low-income communities. Many individuals lack health insurance or face high out-of-pocket costs, making regular doctor visits a luxury rather than a norm. Clinics serving these populations are often overburdened and under-resourced, resulting in rushed appointments where early signs of obesity-related diseases may be missed or minimized. Delayed diagnosis is common, and by the time cancer is identified, it is frequently at an advanced stage with fewer treatment options and worse outcomes. These communities are also disproportionately affected by stress and instability. Housing insecurity, job strain, and chronic exposure to violence or trauma contribute to poor sleep, elevated cortisol levels, emotional eating, and other behaviors that can drive weight gain. Mental health services are often scarce, and the daily toll of survival erodes the capacity for long-term health planning. In this context, obesity is not simply a health issue, it is a symptom of deeper systemic failure. Despite these realities, many obesity and cancer prevention efforts still emphasize personal responsibility, offering generic advice that fails to resonate with those who live in structurally disadvantaged environments. Campaigns often ignore the role of poverty in shaping behavior and the fact that making healthy choices requires more than motivation, it requires options. Telling people to eat better or move more without addressing food insecurity, neighborhood safety, or healthcare inequality amounts to moralizing without offering real solutions. The consequences are predictable. Obesity rates remain highest among those with the fewest resources, and cancer outcomes mirror these disparities. People in low-income communities are more likely to die from preventable cancers, not because they care less about their health, but because the systems around them consistently fail to support it. These patterns deepen cycles of inequality, in which poor health reinforces poverty and vice versa. Addressing these socioeconomic barriers requires more than individual interventions. It demands systemic change. Policies must expand access to nutritious food, build safe public spaces, fund community-based health programs, and ensure universal, affordable healthcare. Only by confronting the broader social determinants of obesity can we hope to reduce the cancer risks tied to it. Until then, the burden will continue to fall hardest on those least equipped to carry it, fueling a public health crisis that is as unjust as it is preventable.